First, we're going to identify the cisterna chyli. So to do that, I'm going to find the kind of apex base of the rib cage, put my palm right there with my fingers pointing up towards her sternum. Then I'm going to have to take nice deep breaths in, try to belly breathe. She's not very good at it. Must run in the family, Carla. And then we're just going to follow that tissue until we feel the pulse through that descending aorta. And there is the cisterna chyli. You can feel that with a little added pressure, part of the lymphatic facilitation. So now we're going to be starting the siphon, which is the very first step in lymphatic facilitation. So I'm going to have my hands, just a couple fingers I like to use, and then do very, very light L strokes, coming up and then releasing, kind of towards the midline. Just going to move up and down that anterior lateral neck. These L strokes, just trying to promote lymph flow, so get this open so when you work down to the injury site, the edema has somewhere to go. Move all the way up and down that. Try not to move the skin very much. Basically, like I said, the goal is to try to promote that lymph flow. Very first step, and then you move, starting from proximal, obviously, and moving distally. Look at my notes. So before starting this treatment, you want to make sure that the athlete goes to the bathroom first, and then drinks a lot of water afterwards. Contraindications, any kidney disease, infections, open wounds, malignancy, anything like that, heart failure, wouldn't want to do this treatment. Yeah, very first step, so removing edema that can't be removed by the capillaries, and then we'll move down the body and try to promote that edema reduction. Moving on to the upper extremity nerve traction test for the ulnar nerve. So we're going to have patient supine, obviously, and just in a nice relaxed position as I bring her into about 90 degrees of abduction. And then I'm going to depress her shoulder with my elbow here and then externally rotate with my hand. And then I'm going to start with her head in neutral as I extend her wrist and her 4th and 5th digits. Feel any tingling or anything? Nope. Okay, so I'm going to take her out. And then we use side bend your head, so bring your ear to your shoulder, ear to shoulder. And do the same thing, so depress the shoulder, abduct, externally rotate, extend the wrist and those fingers. Does that change?
Yes.
Do you feel a tingling down your arm now?
Yes.
So that is a positive, especially if it's relieved by flexion. Does that go away?
Mm-hmm.
So if she feels the burning or tingling down that medial arm, kind of around her elbow, even all the way through her shoulder, you can unside bend your head with either side bending and that wrist extension. That's going to be positive if it's relieved by a neutral head or flexion of the wrist, and that indicates kind of a nerve entrapment, adverse neural tension, and so then we can start doing sliders or anything for that. You want to check for nerve issues anytime there's muscle tightness, long-term immobilization, really any sort of injury. Want to rule out or rule in nerve pain. And then after this, we would always test bilaterally, so we can fix both sides or see if there's a difference. We don't want this treatment to increase any symptoms, so if that happens, we'll stop that immediately. Don't want to do it if there's any kind of spinal injury, disc herniation, stenosis, long-lasting neurological symptoms. That'll be an issue. So now we're going to do a nerve slider for the sciatic nerve. So first we're going to start her in a reverse slump test. So we have her non-test leg up on a stool, and she is laying down sort of on our couch. Is not long enough. And then I'll have her sit up. You're going to have her slump her shoulders, just kind of rest your elbows on your legs, and then chin to chest. Then I'm just going to dorsiflex her foot. You feel that tingling in the back of your leg?
Yes.
So if she feels tingling, relax. Let me move it in, kind of in the back of her calf and in the posterior thigh, and her leg comes off the table. So that indicates some nerve tension. So I'm going to keep her foot dorsiflexed, and then with my other hand I'm just going to pump this leg up and down. Keep slump, chin to chest, bend your neck, bend. And then we're going to do this about 20 times or so, and she should start feeling the tingling, burning sensation kind of working up her leg. So basically we do this until it's either gone or basically centralized back towards your spine. So again, we're going to do this, you can relax, with any sort of long-term mobilization or really any muscle tightness. You want to rule out any nerve pain. Are very susceptible to nerve pain because they do all sorts of repetitive motions, and oftentimes it's at that end range of motion which stretches the nerve, and basically muscles get tight and that restriction doesn't allow the nerves to slide through this. So the goal of these sliders is to promote that mobilization of the nerve, reduce irritation overall, and immediately after the athlete should notice an increase in range of motion, decrease in pain. Like I said, you can do this pretty much every day and until that kind of tightness disappears. But the results should be immediate. Definitely shouldn't be doing this with any sort of neurological issues like long-term symptoms, disc herniation, spinal cord injury, anything like that. If this doesn't improve after 2 to 3 treatments, then stop treatment and try something else.